Making a selection about how to address skin concerns in the different skin types is a big part of what we need to be able to do in our practice. So when we talk about skin rejuvenation, there are lots of things we take into consideration. Probably the most important thing we take into consideration is an individual skin type. The grading system we use for skin types is called the Fitzpatrick scale, and it's rated 1 through 6. So a type 1 Fitzpatrick patient would be somebody that always burns and never tans, and then a Fitzpatrick 6 would be a much darker skin type, which is one that never burns and is always tan. So making a selection about how to address skin concerns in the different skin types is a big part of what we need to be able to do in our practice. Now, the lighter skin types, Fitzpatrick 1, are patients that we can pretty much use any technology in our practice for. But as we start to get to darker skin types, Asian skin, Asian Indian skin, Latino skin, African, Caribbean skin, darker skin tones and types, we need to be a little bit more thoughtful about what we're offering. Fortunately, in our practice, we've got a pretty comprehensive suite of technology to take care of all skin types. So if I have an individual who's a Fitzpatrick 4, 5, or 6 come into the office and they've got some stubborn pigment or some melasma, we have a couple different technologies that we're able to offer. Our latest and greatest is Moxie, and Moxie is a thulium laser that I can treat any type of skin with, and it's really good for melasma. It's nice for turnover of the epidermis in, again, all skin types, and we've had a really enthusiastic response to those particular treatments. We actually brought in a second machine in 14 months because of the need and the demand for that particular service. I have used Moxie in the darkest of skin types with nice, safe improvements. Another machine which we've had for a number of years is PicoSure. PicoSure is considered to be the gold standard for tattoo removal, but it has a special lens called a focus array that we're able to use that particular wavelength on all skin types. So if over the years, as I've had individuals with stubborn pigmentation and they happen to be Fitzpatrick 4, 5, or 6, again, the darker skin types, we've been able to safely manage some of their hyperpigmentation concerns with the PicoSure. Now, the other way to address unwanted pigment as well as tone and texture in darker skin types is some of our topical products, and one of the most common ones we use is called Groot. Groot is a combination of retin-A, hydroquinone, kojic acid, and with or without steroid. And the hydroquinone and kojic acid help lighten dark spots or unwanted dark hyperpigmented blemishes, and the retin-A stimulates skin cell turnover. So it's another great solution for our patients with goals and darker skin types.